So high blood pressure and hypertension are conditions where the blood pressure in the arteries in your body run higher than what they should be. Everyone can have high blood pressure from time to time if they're nervous, scared, or upset, or expecting bad results when they go to the doctor or dentist. Isolated high blood pressure from time to time is not the same as hypertension. Hypertension is when your blood pressure is consistently elevated for whatever reason. Hypertension is defined as a systolic blood pressure greater than 120 and diastolic greater than 80. That's elevated blood pressure. There's stage 1 where the upper number is above 130 and the lower number is above 80. A normal blood pressure is when the systolic, the upper number, is 120 or less and the lower number is less than 80. What does systolic and diastolic represent? So the upper number, the systolic number, represents the pressure in the arteries, and the arteries are the vessels that take blood to your body for oxygen. That represents, systolic is the blood pressure in the arteries when your heart is actually beating. The diastolic, the lower number is where the blood pressure in the vessels when your heart is in between beats. So the symptoms of hypertension oftentimes are no symptoms, and that's kind of why it's called the silent killer. Sometimes the first symptom of hypertension is a heart attack or a stroke. Some patients say, hey doc, I get a headache, so I know my blood pressure is up, or I got a nosebleed. Typically, there are no symptoms like that. Typically what happens is if the person is distressed or in pain, such as they have pain, a headache, sore throat, blood pressure tends to run high. So oftentimes there are no symptoms, whoever they are. But the general guidelines is if you're overweight, lose weight. If you don't exercise, get aerobic exercise at least 30 minutes every other day at the very minimum. If you smoke, cut back on smoking. If you have a lot of salt in your diet, cut back on that. If you're a diabetic, control your A1C. That's what a patient should do for hypertension. There are several classes of medications for the control of hypertension. And to just name a few of the classes, one are diuretics like furosemide or hydrochlorothiazide. They help remove water from the vessels, and by doing that, you can reduce blood pressure. The other medications, or the main ones we use the most, are things called ACE inhibitors. An ACE inhibitor is something called lisinopril, and there's also benazepril. ARB, generically, there's one called losartan, which is very effective. Beta blockers, you might know the names metoprolol or carvedilol. And the calcium channel blockers tend to be things like amlodipine or nifedipine. Again, there are other medications, such as hydralazine and even other ones, but those are the ones that we commonly use the most. It's really important to control your blood pressure or hypertension because if left untreated, it can cause significant problems for the rest of your body. The biggest one is heart attack and stroke, but it can also cause kidney problems, kidney damage leading to kidney failure and dialysis, and it can cause some visual problems as well. It kind of interplays with the complications of high cholesterol and diabetes as well. So the point of treating it, because of some of my patients, doc, I feel fine, man. Why are you so concerned? Why are you trying to lower my blood pressure? Give me a pill, I feel great. We're trying to avoid these complications that can be life-altering. Hypertension can affect any age. It's typically in adults. There are some young adults that have essential hypertension, meaning they're athletic, they're healthy, but they still have very, very high blood pressure. Sometimes that can be related to kidney problems or adrenal tumors, but we typically see it in adults. There are risk factors for hypertension that can promote it, and that would be things like smoking, salt diet, obesity, lack of exercise. But it is very important to identify if you have it and try to control blood pressure, first through lifestyle change and secondly through medication if necessary.